turpentine is not something that you just use willy-nilly. You need to be informed and follow an established protocol to make sure that it's safe, because you can get cleansing reactions, which could be very uncomfortable and unpleasant, and they're just unnecessary if you do the proper preparation. And of course, you need to know what the safe dose is, because like any potent medicine, there is definitely a toxic and a lethal dose. So, you know, what I talk about and teach is really based mostly on the research of Dr. Jennifer Daniels. And now I've had considerable experience with this, and people have no problems when they follow these instructions.
Right,
So,
and that's exactly why we're doing this.
Yeah, that's right. And people do come to me though, and they say, "Oh yeah, I just decided to just take some turpentine willy-nilly, and then I was sick for 3 days, and you know, that would have been predictable and preventable."
Yeah.
So going back to the history, you know, so there's some obscurity and it's hard to find information, but Dr. Daniels had learned that back in the days of slavery in the South in the United States, that the slaves made turpentine and used it for healing purposes, and that when the slave owners or their family were sick and unable to get better with the doctors they were using, they would go to the slaves and ask for their special cure, and many lives were saved anecdotally that way. There is some research from France going back 150 years on turpentine and its toxicity, and other studies. So you can find those if you're willing to go into the archives. But what I think is the most interesting historical document is the Merck Manual from 1899, because turpentine was actually a conventional standard medication even in the United States until the FDA was established and they ultimately banned it from being in any therapeutics. There is one exception, interestingly, and if you don't know about this, but there's one product that is grandfathered in that turpentine is still an ingredient, but they're not allowed to list it as an active ingredient. So if you look at the label, you might not even see it. But this is Vicks VapoRub.
Yeah, right.
And so Vicks is actually a decent medication for some things, like it works really well on mosquito bites, for example. And you might even use it for pneumonia if you cover your whole chest with it. So, so turpentine has been known about, as a healing product for a long time. It was really suppressed by the pharmaceutical interests because, it's basically pharmaceuticals are unnecessary when you have access to turpentine. And what it is it is the distilled sap from the spruce pine tree.
So only spruce.
Correct.
Only spruce.
So it's different from, pine oil, for example, or pine needle tea, or all these other products. And the pitch that you described is a different fraction from the sap. It's essentially what's left behind after the distillation process, I believe. So it may still have some of the healing properties, but not as potent. But I've heard anecdotes of people using it on wounds, like making, some kind of salve or patch out of it and having really good results. So it may, I just haven't explored it so much, but the turpentine is it's the oil fraction of the distillation, not the water or aqueous fraction. And so it's a, mixture of terpenes and some other aliphatic compounds, and it's an excellent solvent, even industrially. And that's where most people know about it, right? It's a paint thinner. And if you go to a fine art supply store, artists know that it's the best solvent for oil paints. And even in the hardware store, you can find it'll be the most expensive paint thinner because it's not made from petroleum, which is much cheaper to process. So the important thing to know that it's genuine turpentine is that it has to say on the label, pure gum spirits of turpentine. And that is the traditional name for this distillate that I'm talking about. So if you're going to take it, make sure it says that on the label. Sometimes they add adulterants like poison chemicals like benzene to it, and they might call that denatured turpentine. But you definitely want to be careful about that. But there's many products available, like from boutique companies, like the product that you showed there, which, even though it doesn't say on the label, it's really intended for medicinal purposes.
So this one from Creekwood Naturals. That is the real turpentine.
Well, I think, what does it say? 100% pure gum spirits, right on the label there.
100% pure gum spirits.
So that's exactly the right thing.
Got
So
it.
good job, Tom.
There you go.
So I wanted to show, I'm going to share screen now, this because I looked at the Merck manual from 1899 before they took turpentine out. And you can see here, I copied the title page. And so the Merck manual is, you know, like a major reference book that lists all medicinal substances known at the time of its publication and various attributes about them. And so this is the last one that had an entry for turpentine. And these are all of the therapeutic indications for turpentine that were in the Merck manual in 1899. So I'm just first going to show you the size of this list. Okay. So in other words, there were 88 different conditions that turpentine was listed as a treatment for. That's quite a lot of conditions. And if we look at them, we see some quite significant conditions in here. Anthrax, okay, I'm not sure what Bright's disease, but bronchitis, calculi, those are gallstones or kidney stones, cancer, okay, catalepsy, a very serious neurologic disease. Chilblains is another name for a very serious condition I can't remember. Cholera, right? Cystitis, that's a urinary tract infection. Deafness, diphtheria, dysentery, emphysema. Enuresis is bedwetting. Epilepsy, if due to worms. Epistaxis is nosebleeds. Erysipelas, that's another infection. Fever. Flatulence, that's an interesting one. But here, gangrene, gastric ulcer, gonorrhea. Hematuria, that's blood in the urine. Intestinal hemorrhaging, hemorrhoids. Hydrocephalus, that's fluid on the brain. Impotence. Jaundice, that's a problem with the liver congestion. Meningitis. So you see tons of serious infections. Acute nephritis, that's a dangerous kidney infection. Paronychia, that's toenail or fingernail infections, you know, like fungus. Peritonitis, that's what happens when like appendicitis ruptures and the stool spreads into the abdominal cavity. So we can go on and on here, pertussis, and all the way to the end. And of course, there are lots of worms on here, like tapeworm. Here, trigeminal neuralgia, very debilitating condition. But here, typhoid fever, smallpox, and yellow fever. So all these serious infections, many of them, you know, falsely attributed to viruses. But turpentine is listed as a cure for all these things. And then here are the physiologic actions that it is attributed to it. So this is antihelminthic is to treat worms and parasites. Antiseptic is for infections. Diaphoretic, that basically means it makes you sweat, like sweating out a fever. I've never heard of it used that way, but this is what they reported. As a diuretic, it will increase your urine production. An expectorant to help you clear, you know, mucus and blockages, and a styptic, which is to stop bleeding. Like people might remember that from shaving, they would have like a pen that they use. So you could use turpentine for that purpose. So it's quite an impressive array of indications.
I also heard that it was the only, quote, medicine that the slaves in the United States were actually allowed to have or use. Although I think they could, you know, forage for herbs, but
right,
that's pretty much it.
Well, you know, it's very inexpensive and it's very easy to make on your own. You know, if you can make moonshine, you can make turpentine.
Yeah. Right.
So, you know, it's very accessible. And, you know, this is why it's such a threat to the pharmaceutical industry, because, you know, I mean, you couldn't have paid more than $10 or $15 for that bottle. And, you know, that'll last you years.
And it never goes bad, I think. Is that?
I'm not aware of it really going bad, to be honest with you.
Yeah.
It's not light sensitive or anything, so it lasts quite a long time. So you know, some important things to know are, one, you know, the maximum safe dose that you should ever use in one day is 1 teaspoon. And that should be like the total dose. So if you might take it orally and use it on your skin, so make sure that the total doesn't exceed that dose in one day. So that's like an important safety guideline. By the way, the lowest dose that has been reported that was fatal, and this was of a young child, was 3 tablespoons. So that would be roughly 10 times the maximum safe dose that I'm talking about.
Okay.
And it can be used on the skin for quite a number of conditions, including like cellulitis or serious skin infections, as well as abscesses, wounds that like are getting inflamed, or, I often just use a few drops to dress a wound if it's, more than just a little tiny nick.
So basically, is the idea that it's, as a solvent, and besides it has other terpenes and other, beneficial substances, but it basically essentially binds to toxins and pulls them out.
Yeah, so here's my theory about how it works. And I also believe, or my hypothesis is that it is the solvent properties that make it successful. So what I think happens is, our body is aqueous, right? It's made of water. Water is the key component. But we do have some like fatty compounds in our body, right, that repel water and don't, they interact with it very differently, but they can't be dissolved by water. So what I think happens is that many of the toxins that we're exposed to are actually also oil soluble, fatty, greasy junk. Like, for example, if you take the, P-trap out of your sink, or any drain pipe in your house and look at it, and you can wipe your finger on the inside, and this greasy gunk, right, will always collect there. So my theory is that the same kind of thing happens in all of our blood vessels and in the parenchyma, or the substance of our organs. And, this is actually vascular diseases, specifically this buildup of stuff in the blood vessels, and it oxidizes cholesterol and, activates the clotting system and causes all sorts of problems. And that when we do conventional cleansing, that it's really kind of aqueous or water-based, and it just leaves, like, it can mechanically agitate some of this stuff and get it out, but there's like some, layer that binds, that stays behind. And I think this becomes the preferred milieu often for parasites, that if enough of it build up, then parasites will establish themselves, in that milieu. So when you use the turpentine, it essentially gets in there and dissolves that gunk and totally cleans it out, kind of like if you're using the, Drano or something like that, although it's not, toxic like Drano. I mean, Drano is hydrochloric, it's sodium hydroxide, a very potent alkaline, corrosive substance.
Right.
But, in this case, it's just a sort of, a mild solvent that doesn't really have untoward effects on our physiology. But it dissolves this, and then, those waste products are then go through the liver and out, the bowels into the toilet, if we do the proper things to stimulate that system to move it out. And so, so that's how I think it really is effective. And similarly, when you have skin lesions, like a skin infection or, lumps and bumps of various kinds, that's your body trying to express toxins through the skin or store them there because they won't damage a vital organ. And by putting various solvents on those lesions, you basically absorb those, or dissolve those toxins into the blood vessels. And if you have stimulated your bowels and your liver, then they'll just remove them out of your body rather than having them resettle somewhere else and cause another problem. Yeah. I mean, that's what a cleansing reaction really is. It's when the toxins get liberated in your body, but they have no place to exit, and they resettle somewhere else, or just are circulating around the blood and cause this cleansing symptoms.
Got it. Okay. All right. So that's the theory, and we know a little bit about what indications, what conditions we can use it for. So let's hear about how you actually would go about doing it.
Yeah. Well, let me just add one a really important indication, because these illnesses didn't exist in 1899, really, or at least not on the scale that they are now. And I'm talking about autoimmune disease.
Yeah.
So in my observation of people who have done this with various autoimmune disorders, including, ones that are maybe more controversial like fibromyalgia, but also ulcerative colitis, Crohn's disease, lupus, etc., that people have had amazing results. And there have been many people who were completely cured of those conditions. So that's an important area to consider turpentine.
Got it.
So how do you go about doing it safely? So for, topical use, it's much, much simpler. You can just use it right away, but what you want to do is have some other kind of procedure in place to let those toxins that you dissolve from the skin get out of the body. So the simplest thing would be to stimulate the bowels and the liver, and you can do that with just an enema. You could, if you're going to just have one big blowout, you could take like castor oil, like a quarter cup, or you could use herbal laxatives.
Castor oil straight?
Well, you can mix it with something down, but yeah, you really need that much. Some people need more than that to really clean yourself out. But I would reserve that for if you have a serious condition that you're treating.
Yeah.
But you could just use some herbal laxatives too, like senna and cascara and barberry root. There's a lot of preparations that have blends of those things that are more or less palatable. So, but you could also do, other things, like you can do like a bath with bentonite clay or Epsom salts, or you could do an infrared sauna. And then that might be, even more makes sense for the skin, because you're using the sweat glands and the pores to get the stuff out of your body. So you just need that combination. Otherwise, those things will resettle somewhere else, which is what you don't want.
So first step, so you've got some boil or some kind of cellulitis, a quote, infection on the skin, or even some area in the skin that's painful maybe, or
you have like some lesion there, that a bump or lump or a scar, many things that are abnormal in the skin. They can all potentially respond to solvents.
Right. So basically you probably drink some water, you do either an enema or take some sort of herbal laxative, make sure your bowels are pretty clear. Is there you have to have 2 bowel movements, 3 bowel movements, or doesn't
right? Well, if you're just using a couple of drops topically, it's not going to be, you don't have to worry too much. If you just, can, even like the day that you use it or for a couple of days, make sure you have a couple extra bowel movements, like not go too crazy. But if you're going to take it internally, then you have to be very, very strict. And I feel the safest thing is you have to have a minimum of 3 bowel movements a day for 14 days, along with taking enough water, because, if you're dehydrated and your blood is thick, you can't clear out the stuff. So you're kind of like doing a pre-detox, getting out all the water-based stuff, so that when the turpentine gets in there and gets that greasy junk, that your system's not overwhelmed with so much toxicity that it can't get it out.
Got it.
So
skin, you do a little bit herbal laxatives, enema, maybe colonic, do some sweating, and then you do what?
So after you do that preparatory work, and I also recommend doing a 30-day cleansing diet at the same time that you're doing the prep work. So that would be just basically like a strict whole food vegan diet, but without legumes and without any gluten containing grains. So you could eat like quinoa or brown rice, root vegetables, and then, all regular vegetables. You limit the amount of fruit temporarily to 1 piece of fruit a day, just because many times the parasites want sugar, and you're kind of like starving them out a little bit before you remove their furniture with the turpentine. And but that's not like, if you're already in a situation where you've been doing cleansing and you're somewhat detoxed, you could probably eat a more full diet, but you definitely want to like make sure that you don't have any processed foods. You don't want to be drinking any alcohol. You want to get rid of non-water beverages and only drink water. Make sure you're, it's really important that you're adequately hydrated. I recommend at least 1 quart or liter per 60 pounds of body weight a day. And it needs to be purified water at least, and, purified and structured would be optimal. But so other people, might want to do a water fast to prepare, and that's reasonable as long as you do some real cleansing and have the bowel movements and the water, and you don't put in extra toxins. That should be, sufficient to prepare you. Some people, might be super toxic, and they might even have to do it a little bit longer. So like if you go through a protocol like this, and we can tell you where to find a published protocol, if you take some and you have any cleansing reaction at all, like any discomfort, you should just hold off on taking any more and do some more cleansing first. So another week.
Does this preclude, like, somebody just turns up with, like acute pneumonia or kidney infection? Does that mean they can't really do turpentine?
No, not at all. But I would say that there's a different way to do it for that. So like in an emergency situation or an urgent situation, there's 2 things you can do. So one is if it's a systemic illness, like even sepsis, or even if you don't know and someone's like, really, really sick and you don't know what to do, you can give turpentine with castor oil. And so you put a 1/4 cup of castor oil and 1 teaspoon of turpentine. You can mix those together because they're both oil solvents, and take that. And because that will guarantee that you will, have a huge bowel output. So you won't, and it's also like a life-threatening or urgent situation. So that's like the shortcut if you needed to do it quickly. And that would prevent, any severe cleansing reaction. And you can repeat that daily, if the person still remains ill, but they're getting better. For pneumonia, there's another way to do it. I definitely mentioned that you could cover your entire like rib cage with Vicks Vapor Rub, and that may be therapeutic. But what people have done that has basically had them recover from pneumonia in 24 hours is to make a steam infusion with turpentine. So you definitely do enemas or something to, clean out your bowels at the same time, but you just take a quart of water, like distilled water or some purified water, and add 2 cloves of garlic, boil it for 10 minutes, and then turn off the heat and put 5 drops of turpentine on the top, and then put a, towel over your head and do steam inhalation for 5 to 10 minutes. And you can do that 3 times a day, and then do a couple of enemas, and that should have really good results for pneumonia.
Got it. Okay. So there's acute illness where a person's not prepared, and that's, you do bowel cleansing, either enemas or some laxative, but you don't need to really, because you're putting a teaspoon of turpentine in a 1/4 cup of castor oil.
Right.
And
so
drink a lot of water, and you should be good with that.
Yeah, and make sure you're close to a toilet when you take it.
Right.
And be prepared to sit there for a while. But that could, totally turn a critically ill situation around.
Does that help? I would imagine that might even help for pain, or like an abscessed tooth or something like that.
Well, if you have something that is focal at one particular site, I would probably go for more localized treatment. I haven't heard of people using it in the mouth, for a tooth infection. I would generally think about other things with that situation. But if it's like if it's an abscess, if it's in the gum line, something where, they would want to do surgery, then certainly that would be an appropriate thing to do. You might even be able to just, put a small amount and like swoosh it in that part of your mouth, or you could try to, put it on your finger and rub it in that area, certainly. But I would use it like at the site rather than systemically for that. But if it looked like the person was getting septic from a tooth infection, that's when you go for the castor oil mix.
Got it. And so then the other one is if it's in the lungs, probably bronchitis or pneumonia, then you do the steam inhalation along with the bowel cleansing and drinking
Yeah,
and stuff like that.
exactly.
So then the other one is the more like autoimmune sort of chronic things. So you're sick generally.
Yeah, for a number of chronic conditions, or any condition where with parasites, autoimmune diseases, a lot of other things, possibly even cancer. I mean, I don't have direct experience, but it's definitely like there was one person with a recurrent lymphoma who was able to reverse that with using a solvent on the site, turpentine mixed with castor oil, and then also doing systemic turpentine.
And so that procedure is 30 days of this very clean diet.
Yep.
And 30 days of having 2 to 3 bowel movements every day.
No, it's got to be 3 minimum. And you have to keep that up as long as you keep taking the turpentine. So basically the first 2 weeks, right, you have the cleansing diet, the water, and the bowel movements. Then you can start the turpentine. You continue the diet for 2 more weeks, and then you can start reintroducing other food groups, and you should do it slowly and pay attention to how your body responds to those food groups, because you might identify that your body is intolerant to something that you might want to avoid. But you can go back to eating pretty normally after the 30 days and still continue the turpentine. So to keep taking the turpentine, you just need to have the water requirement and 3 minimum bowel movements, and then it continues to be safe. Like you could even keep taking it for like 12 months. And there have been some people like with autism who have done it that long and, continue to put worms out in their stool for, almost indefinitely, it seems like. Right. But you should basically continue it until you feel you got the maximum benefit. And for most people, it's around 4 weeks. Depends on how seriously ill they are. So, the more ill you are, probably the longer you would continue to do it. And normally I recommend, or I would say, to do it 3 times a week. Dr. Daniels says 2 times a week. And the dose, that range that's effective for internal use would be between a ½ teaspoon and 1 teaspoon. And, everyone, you should just trust your body when you take a ½ teaspoon and see how it feels. And if your body feels like it wants more, then try 3/4. And, let your body guide you to what the right dose is for you. But anywhere in that range is enough to be therapeutic.
And how do you take it? Do you just take it straight on a spoon? Or I know she puts it on a sugar cube.
Yeah. Yes. So I go with the time-honored sugar method, and aside from that emergency castor oil situation. And, it's too challenging to use sugar cubes. So just use granulated sugar, like make sure it's organic, but trust me, it's better to just use a plain white sugar.
Yeah.
And because, like I tried one time using the raw sugar, and it's got like a lot of sharp edges on the crystals, and it scratches your throat going down.
Yeah.
So, by the way, if you do get any throat scratchiness in your throat, it's from the sugar crystals, not from the turpentine.
Got it.
But so you put like 3 times as much sugar as turpentine. So if you're going to take 1 teaspoon of turpentine, you take 3 teaspoons of sugar, which is a tablespoon. So you might need a serving spoon to do this. If you can get it all in your mouth at one time, you can split it in half if you want. And then the reason you do more sugar is because when you drip the turpentine on top, some of the sugar should be dry, and some of it will be wet with the turpentine. And, I don't know if this is just folklore or if this is really true, but the thought process is the sugar is bait for the parasites, that they take up the turpentine. Yeah. But I'm not even sure that, the turpentine even kills the worms. I think they just don't need to stay around anymore once that oily sludge is gone. Yeah. But because people don't get like a kill reaction, they don't get worms in tiny little pieces in their stool. You generally are intact. which is good because, you know, if they get chewed up and they release the contents of their body, then that will make you sick.
Yeah.
So that's why this is a very gentle compared to, you know, pharmaceuticals that treat worms. They are not gentle and they could cause that kind of a inflammation reaction.
Got it. So half a teaspoon of turpentine gives you 1.5 teaspoons of sugar. You drip it on with an eyedropper. Some of it should be moist, some of it should be dry, and then you just put that in your mouth and swallow.
Yep. And well, you know, you might chug some water after. I actually found, because, you know, it's recommended to take some antioxidants while you do this protocol. And so I tried putting ascorbic acid powder in the water and drinking that to chug down the turpentine. And I found that way was pleasant. But you don't have to do it that way. You could just do it with the straight water.
Yeah.
The important thing is you just get it down, but don't like chew on it or anything like that. Just, you know, keep drinking until it all goes down.
Got it.
And then you're good. I recommend doing it in the evening because you will have some burping for a few hours after, and it'll be, you know, taste like turpentine.
Yeah.
And so if that happens while you're sleeping, it won't, you know, it'll be less of a nuisance.
Got it. And then you do that either 2 or 3 times a week for 4+ weeks until your situation is better / maybe resolved.
Yes, exactly right. And you can, if you want, beyond that, you can do a maintenance schedule, and you don't have to do the cleansing diet all over again. You just have to make sure that at least for a couple of days beforehand, you have extra bowel movements or do an enema, you know, on the day you're going to take it and the day after. But then you can, you know, do it once a month, once a week, you know, or you could, you know, once a year do another protocol. Like that's what I've done. I've done it 3 times now myself, kind of like once a year,
Yeah.
roughly.
And Jennifer Daniels sells something called Vitality Formula, which is a sort of easy way to make you have more bowel movements.
Yeah, it's Vitality Capsules, and the website is vitalitycapsules.com. And that I was going to mention that because if you go there, you can download the Candida Cleaner Report, which is essentially the protocol that I described, and a lot more information. And so that is your instruction manual to do this safely and make sure that you follow it, you know, exactly the way it's written, if you want to have the best results. But yeah, the Vitality Capsules is one of the easiest things you can use to increase your bowel movements. And it's and she, you know, she's very careful about sourcing her ingredients, and a lot of times she runs out of inventory because the ingredients didn't meet her quality standards.
Yeah.
But it's a blend of 3 herbal laxatives: senna, cascara, and barberry root. And then it has several other herbs that are more like soothing or have other purposes. So it has like garlic, ginger, Cape aloe, and then there's like an extra strength formula that also has cayenne pepper. And so, you know, you basically, the way you do it is you take, you know, 1 capsule the first day, and you should take this with your biggest meal of the day because that will lessen the possibility of cramping. And make sure you drink enough water with it. And then you see how many bowel movements you get the next day. And if you don't get 3, then the next day you take 2 capsules. And you keep adding 1 capsule a day until you can guarantee that you get 3 bowel movements. So some people get this really quickly at 1 or 2 capsules. I have some bowels of iron. So like I had to take, I think 12 or 13 of the regular strength, and then I switched to the extra strength, and I could take 6 or 7 of those and get that output. So everyone's going to be unique, and don't be worried if you like have to take a lot of capsules. But there are other things you can do also if you prefer, like that things you didn't mention, Tom, that can increase your bowel output would be drinking celery juice.
Yeah.
You probably need at least a pint. You'd have to also, you know, titrate it to get the right output. And then if you boil beets, right now you could also use prunes, but I don't want to recommend that because they're very high in sugar. But you know, like if there's a child that might be doing this, that might be an acceptable shortcut to get them, because they can't swallow pills, or they probably might resist enemas. But the fallback always is that you can always do an enema, and just one enema a day is sufficient to prevent the cleansing reaction. So if you, like, let's say you want to get going and you don't want to wait till your body to naturally have 3 bowel movements, you can just do a daily enema, and then those days count toward the 14 days.